So this video covers some areas usually used by the nurses. So I'm going to add the ability to register patient in case for some nurses who might be tasked to register patient. So let's go straight into the training. So now when you log in, you see the pages here based on your role. You see either all or some of the pages. So let's show you how to register a patient. So we click on the new patient, then a new patient registration. We select today's date if the person is a new patient, but if the patient is an old patient, non-existing patient, then you choose what any previous day and enter the person's record number on the card. But here I'm assuming the person is a new patient. So the date of birth is, so either you enter the date of birth or you enter the age. I enter both. So the age is used when the person doesn't know the date of birth. So the person can tell you I'm 45 years, then you put 45 there. But when the person tells you his date of birth, you simply have to put your date of birth, put date of birth there. So all the field that is marked asterisk are all mandatory. Religion I can leave it, education level I can also leave it, right? So I'm just filling the information that are mandatory. And then health insurance. So if the person is a cash patient, you choose uninsured. If the person is NHIS, choose NHIS and fill the other details here. Any details that are important, the system will force you to fix it. So for example, the card type, the insurance number, the serial number, the expiry date, the scheme if any. If as long as there's a drop down here, the system will force you to select something here. Right, the district, the sub-district, and whether the person is a dependent. So for NHI, dependent are people who are less than 3 months old, right? Who rely on their mother's card. But if there's no if the person is a grown up, like more than 3 months, according to NHI, then the person should have his or her own card. Then the person will not be a dependent. So co-payers are other policies that covers what NHI doesn't cover. There are times when somebody might have NHIs, but then there are things that NHI doesn't cover. He might want another company to bear those expenses. Those are the co-payers. So here you see all the list of companies that are registered on the system where the person also belongs to. So you select it and you fill the additional information where necessary. So then here you select the billing information. So if the person is a new patient, then it will ask you to select something here like a card fee or registration fee or something like that. So that is that. And then so you have to fill the personal information, the communication information, the health insurance information. The picture is actually not used often, so the billing information. So let's go back to the health insurance information. So if the person is also a private insurance, you select and you fill all the necessary details. If the person is on capitation, you select yes. If it's not, you select no. So if it's yes, then all the capitation will appear here, and then you select the appropriate capitation for the client. If it's no, you choose just no. So this thing will only show only when the policy is on capitation. So if I select maybe Metropolitan, it is still there. Let me choose customer and see. So with customer, it didn't show. It means that customers are not on capitation. There's no plan that is on capitation in customer. So once there's any plan, any insurance policy with a capitation plan, then as soon as you select it, it's going to appear here like this, right? So here you fill all the necessary information. The person's company, whether it's a personal card holder or belong to a company. If the company is not there, you can actually select or create a new one. If it's there, you just pick one of them. Then the insurance plan, also you pick the insurance plan. All of them will be there. If it's not there, then you can ask your IT guy to create for you, or you can create it yourself by clicking on add new plan. You have to make sure that whenever you are creating these things, make sure it is not there, it's already not in the list, to avoid creating duplicate plans. And whether the card holder is dependent on another person. If it is dependent, you say yes, and then you fill all these details. If it's no, you choose no, and then this is